Harmful effects of air pollution are not just limited to the respiratory system. Poor air quality can cause several problems for the eyes as well. Doctors say that eyes are vulnerable to the effects of air pollution due to the direct contact with the outside atmosphere.
Main effect of pollution to eyes would be dryness, especially those people who are working. Children, they are affected much more than any other group of people because they are working outside, playing, and the pollution can create congestion, that is redness of eyes, lot of irritation and watering and pain. The particulate matter which is there in the environment, they change the osmolarity of tear, which osmolarity increases, and the pH value. Normally the tear is normally neutral. They become acidic with the nitrous oxide which is there, or sulfur dioxide which is there in the air. They can cause increase in the pH, and this increase in the pH cause a lot of redness in the eyes and actually create painful eyes for people.
Indicators can range from itching or stinging in the eyes to an inflammation of the cornea. Children and those aged between 20 and 40 years are at a greater risk of eye-related problems caused by pollution. While pollution can trouble anyone, the eyes may be adversely affected, especially in those who wear contact lenses or are already prone to eye allergies.
People who are using glasses for their refractive error, the glasses can become little dull, the contrast can go down because of air pollution. So you may require a little change in the glasses in terms of making your refractive error corrected. The main suggestion would be to be indoors if you are having a dryness for a long term. Chronic dry eye patients or people who already have a lot of allergies, they should be wearing protective goggles which have a larger frame. For cleaning the eyes from inside, we normally don't recommend splash of water in the eye. You can use artificial tears which are very commonly available, and they should be used in frequency of 3 to 4 times a day so that they clean the eye from inside. Those people who are already using artificial tears for various other regions like dry eye, the frequency of installation of drop would increase. In fact, if you have a lot of redness, I would recommend putting an ointment or a gel in the night time before you go to sleep. And if you are coming from outside, wash your hands and your face with a soap and put few drops of artificial tear, then go to bed. That will give you a lot of relief. And if you are using cold water for washing your face, it is recommended rather than using a warm or hot water in these polluted situations.
Consult an ophthalmologist if problem occurs and prevent your eyes from direct exposure to pollution. Kiran Bhardwaj, DD News.
The Central